BV, or bacterial vaginosis, is a vaginal infection that's really common. 1 in 3 women are estimated to have BV worldwide. 1 in 2 women get their BV back again after treatment. BV is likely caused by a group of bacteria. Like we know, in the gut, there's a gut microbiome. In the vagina, there's a vaginal microbiome.
A healthy gut has a very diverse microbiome, but it's the opposite in the vagina. It's actually populated by a small number of lactobacilli that maintain quite a healthy vaginal pH. And the loss of the healthy bacteria means women's risk of premature birth, miscarriage, her risk of HIV, of acquiring all STDs greatly increases.
I started getting them quite recurrently, abnormal discharge and smells and things like that. And I'll just go to doctors and get treated with antibiotics. It would almost always come back, and I knew it's like not really worth it for me to even go to doctors.
I was feeling there is nothing that I could do to get relief from what I'm feeling. It affects your mental health a lot.
The bacteria that cause BV can be located in men, and especially in penile skin and also in the urethra. So this suggests that BV is probably sexually transmitted, and that is why so many women get it back again after treatment.
Treatments are generally or always in fact directed only at women and do not include the partner. So our group decided to evaluate an oral antibiotic and a topical antibiotic cream in men. At the same time, the female partner was being given recommended antibiotic treatment.
What we can see at day 0 before the couples have started taking their antibiotics is that there's really high levels of BV bacteria present in the vagina of all women. And when I had a look at the male samples, I could see that there were also really high levels of BV bacteria present in the male genitals as well.
We found that male partner treatment given simultaneously using an oral antibiotic and a topical cream just for 7 days had a very marked impact on BV cure for women.
What we saw was a reduction in the levels of BV bacteria at all 3 genital sites. And in the vagina here, we start to see an increase or return in lactobacillus species in most women as well.
It just made a lot of sense when I heard that my partner could be treated to prevent it from coming back. I was like, of course, that makes so much sense.
When I guess it came down to it, I was more than willing to help and be a part of it.
It's a really easy treatment for men. Actually, it just takes a few minutes a day, maybe less than a minute. It was something that for a relationship gives you more confidence between you and your partner.
This treatment trial really conclusively shows that recurrence is driven by reinfection of women.
It is an STI, and it needs to be treated like one.
This is the first strategy globally that has shown a really marked improvement in BV cure for women.
I really hope that we can take the treatment guidelines that we're going to change here at our service and actually implement it worldwide.
I would really love clinicians to start talking about BV as a mutual responsibility between couples.
That it's something that you can overcome together.